Hi everyone. I just wanted to do an update video on my first couple of exams that I've done. I kind of talked about my safety exam in the other video, I believe. I don't go back and remember. I have too much stuff in my brain. I don't try and remember like what I talked about the last video. So if it's redundant, then don't watch it, because that's what I've been doing, is just lots of things and I can't keep track. Anyways, I had my first anatomy exam last Tuesday, and it was actually a really stressful experience because we got down there around, I don't know when, it started at 1, so we were down there like, I don't know, little less than 10 minutes till to get into our scrubs, because we wear scrubs in the lab. And I started getting really nervous, like really nervous, and starting to like tell myself like, I can't do this, I don't feel like I practiced enough, which I did because I was in the lab all the time. Went in a couple times before the exam. You don't really want to be in there all day because when you start going into the lab for a long period of time, you just kind of start second guessing yourself, and you definitely don't want that. So actually, when I was studying, I'd go in for like an hour, or maybe a little under, a little over, depending on it, because the lab closed on Sunday at 12. So I went in twice on Saturday and once on Friday. As grad students, we are given almost 24/7 access to the cadaver lab, except for times when there are PAs, OTs, or undergrads in there. Undergrads are in there like all of the day on Wednesday, but it's not that big of a deal because most of us are in class and doing other things, so we can work around it. Anyways, getting back to the exam, so I was feeling really, really, really nervous, even though I knew that I had prepared really well. Anyways, got in there. We were given a sheet that had like space for like 33 questions. It was a written test, no multiple choice or anything, so you had to identify things. Got in there and realized when we walked in the door, all of the cadavers were completely draped except for a small portion of where the question was being asked about, which was not exactly what we were told. But anyways, I won't get into that too much because it's probably not appropriate for me to be talking about that too much. But basically the gist is I got thrown off guard because I had no idea how much the cadavers were going to be draped. And now I know. But it was a miscommunication, I think, between the professor and us on how much was going to be covered, as far as like draping wise versus what we would get to see. But anyways, we were in there, so I started completely freaking out because I had not practiced that. And I started freaking out. About halfway through, I really was on the edge of losing it. I made it through the test, and then he's like, okay, let's go through the answers. And we all get wide-eyed and think to ourselves like, no, I really don't want to go over the answers right now. I really don't, because that was really rough. But we did anyways. I wasn't really paying attention. I really, to be honest, didn't really care. I left the room and I started bawling. And I'm going to be honest with you guys. I was bawling. I was shaking. I went into the bathroom and hid because I thought that I had F-bombed that test. Good news is I didn't. I passed. Passing is 80, so I don't share grades with my roommates. I won't share it on here, but passing is, I think, 75 or 80, and I got above that, so that's a good thing. So that was the anatomy exam. We got our grades back the day after. The great thing about having such a small class is like, my class is 20 people, which, some people are like, well, why is your class so small? Like, what's wrong with the school? But to be honest, like, I couldn't imagine any other way. Like, it's just amazing. We get so much one-on-one time with the professors. All of them know us, and they know where our weaknesses are. So it's really awesome. So anyways, that was the anatomy exam. And then after that, I started prepping for clinical. So clinical is like skills we would be using in the clinic. So right now we're doing, this test was covering manual muscle tests, which is like checking the strength of muscles, range of motion, seeing how far you can move, and if there's any tightness, you can analyze that, and compare it to a normal value and what it's supposed to feel like. And then we also do muscle length test to see, again, how tight the muscle is. It's different than manual muscle testing. It's really cool because you can actually isolate. So the tests are specifically for muscle groups, or muscles themselves. I mean, all of them are, but, yeah. And then, manual muscle test, range of motion, muscle length. We had reflexes. So we had, patellar reflex and Achilles and hamstring. I chose not to do hamstring because you can do most of the same testing with Achilles or patella, and hamstring is really a pain in the butt to do. I know I'll have to do it like at some point, that's fine, but I just didn't want to do it. There was no point to doing that if I could do a little bit simple tests. Sorry, I'm going to take the easy way out on that one, especially when it comes to my test grades. They're not going to be impressed if I try and do a more complicated one and mess it up. They will grade me the same, so I decided not to do that. And then we had myotomes, which is looking at spinal levels and different muscle groups. So I posted a video before. If you want to see me do a really like funny like kinesthetic learning dance of me doing that, you can go look. I just posted it a couple days ago, so if you want to see and laugh at me. But it helped me like memorizing them. And then we had dermatomes, which is like a sensation where we're just touching certain regions to test different spinal roots. So dermatomes, myotomes, and then I already talked about reflexes. Yeah. So our test was, and then also palpation. So we'd be given a region that we covered. So maybe like anterior knee, or lateral, medial, or no, it was lateral, posterior ankle. So lateral is like the outside of your ankle, and then posterior is the backside. And that's what I got. And then we had to palpate like 3 muscles, 3 bony landmarks, 1 other structure, and then 3 other additional things, just to show that you know what you're talking about. But you didn't know going in, so you could have gotten any of the regions. I think it was like hip, knee, and ankle, and foot, because that's what we've done so far, which is really incredible to think about. In 5 weeks, we've done the entire lower extremity, which I think is very impressive. So that was that test, and we had 10 minutes to do a manual muscle test, a range of motion, a muscle length, the palpations I just mentioned, and the spinal sensation testing, or muscle spinal testing. Oh man, it's been a long day. The ones that I talked about before, they're myotome, dermatome, or reflexes. So that was kind of how my tests went. I passed both of them. So like I said, I believe it's 75 for passing, or 80 or something like that, but I scored above those, which is good. So I'm really happy with how it went. I feel like I was well prepared going into both, and it feels really good to have, my studying pay off. It feels really good because I've had experiences before where I've studied really hard and then haven't done as well. So I'm glad that that hasn't been the case yet. We still have one more exam in this round of midterms. It's a written exam, so it's definitely going to be the most difficult. So I'm going to be working on studying for that and just doing the best I can on that one this weekend. So yeah, I think things to like that I learned from this set of tests was I need to get a grip on my nerves for sure and believe in myself because sometimes I just get into this tailspin that I don't know what I'm doing, that I haven't practiced enough, but I need to just be confident in myself. But a good thing that it showed me is that hard work does pay off. So yeah, those are like things that I learned for this round of tests. I don't know what I'm gonna do like for the next set, like if I'm gonna change my study habits at all or keep them. I feel like I'll keep them because I did well for this one. So next week, actually this week, we started on the upper extremity in lab because we had our exam on Tuesday and we had another lab on Thursday. So we're already starting into the upper extremity. So that's really exciting. So they really move us along. But I just feel amazed at like how much stuff we've learned in 5 weeks. So anyways, I will talk to you guys all when I have some sort of other update, probably next week after my written test or something like that. And I will talk to you then. Bye.